history, it is started very long before in 700 BC. In that time, people were used leather or wood, because sometimes what happened in the war, people might lost their limbs. So in that case, what they have done it, they prepared some kind of limb by using wood material, and then they just placed using some kind of leathers and they suture it. But if you see that the function of is not restored, but we can say it is like more or like a beautifying agent. And once the metal come into the picture, people or the person, they are more looking about the metal side. And you can see that image, the person having the leg as made up of the iron rod, which is developed in 19600. So these are all the history, but this is not mimicking or replacing the natural function of tissue. But once the gold and metallic substance comes in, so in that time, the gold is one of the best material because it will never corrode. So people have used uh, in dentistry as a bridging materials. And after that, because these are all very simplest procedure using limb and leg, but in the ape structures we really need to have some kind of function. It's like we are is locomotion and we need to mimic the mechanical strength. So people have tried with the titanium implant. It need to have compression fixation and the fracture rips. So people have tried uh, using metallic substances like titanium. In 1960 or 1970, the emerging of polymers replacing in all the functions like 3D printed organs, and using artificial skin, we can replace on any function of the burnt tissue or diabetic wounds or any other trauma condition. We can replace using this kind of artificial materials. So in more recently, the stem cell technologies emerging area of research. You can see that the mouse bearing one ear on the backside of this year, and this is which is developed with the Vacanti model in 1997. The still but to accomplish this kind of work, we really need one multidisciplinary field or interdisciplinary field of scientists, ranging from material scientist, bioengineer, chemist, and biologist, and even computational scientists, immunologists, and even surgeons, and of course the businessmen to take care of this material into the commercial product. So this is the history of biomaterial, starting from the wood and leather to the now the synthetic material using the polymers and even stem cells. So what is tissue engineering? I'll give some brief information about tissue engineering. As you know that very well about automobile engineering or civil engineering or electronic engineering or computer engineering, similar like in that way, this is the one emerging field of research is called tissue engineering. In automobile engineering, you are just designing one kind of car or motor vehicle. In civil engineering, you are constructing one building, and in the electronic engineering, you are designing some kind of lab chips or some electronic items or biosensors using the electronics. And in this case, in the tissue engineering, we are developing kind of tissue. This is called the tissue engineering, which this is the basic paradigm for tissue engineering. This is usually we call it, this is the subfield of biomaterials and the development of biological tissue which can restore or maintain or improve or also mimic the natural function of tissue or as otherwise the whole body. So here the first step is isolation of cells. For example, if you want to develop any tissue in our body, for example, if you want to develop one skin tissue, we can just take some biopsy of our tissue, and then we have to isolate the cells, and then that is called the A, and the B, the isolation the cells and the culture the cells, and after that we have to multiply the cells in the billions and then expanded it, and then this is the exact procedure for tissue engineering. We need to have one matrix, and then the growth factors and stem cells and nanoparticles, and then small molecules. Once you made that one, then finally we can develop the mimicking structure of artificial tissue, which can be further used in the defect area, or which can defect area or the diseased portions. So my area of research is basically bone. Before going to tell about the bone, I want to tell you about what is the structure of our bone. It's look like a very similar, simple also, but the hierarchical structures, the cancellous bone and cortical bone, there are the 7 different architecture present in our bone, starting from osteons, and then lamella, and the collagen fibril, and the collagen molecules in that hydroxyapatite present. And you can see the scales work from the millimeter size and the micrometer size, and it's going to the nanometer size. So this is the way we can develop from the nanometer size into the large size bones. So why you want to make the bone is really important. Yes, of course. So if you see that in each and every second, say, we can see in the even in the news channel, there is some accident which will lead to the trauma or the bone defects and other bone fractures and other several bone defects, starting from osteonecrosis and tumor resection, and then osteoporosis and arthritis. So is there any treatment option are currently available? Of course, we have 3 different kind of treatment option. One is autograft and allograft and synthetic grafts. So what is at allografts is nothing but we are taking the bone from the iliac crest, and we can place it in the defective place. And allograft is nothing but we are taking from the cadaver bone. The person died and they stored the bones in the bone bank. Whenever we need it, we can take it and implanted it. And the synthetic graft is an emerging area of research for bone implantation. It has ceramics and polymers based material and biotech classes. These two grafts, like autografts and allografts, have some problems like insufficient donor site, and it also needs secondary surgery. And in the case of allograft techniques, non-osteoconductive and disease transmissible like HIV and hepatitis or the main concern which hindered to use of these two grafts. So there is one option we can develop by synthetic material, but this also is having some issue. It's not osteoinductive and the leaching of material, and also in expensive material. So what is the current technology involving? As I told you in tissue engineering basic paradigm, the is nothing but we need to have one scaffold, and we need to have osteogenic factor, and we need to have cells. And once you combine these all the materials, is like for example stem cells mean it has to go in bone osteogenic differentiation, and this is called the tissue engineering approach, and then we can craft it. So let's give some more examples on what I have done it in last few years, and chitosan based composite for tissue engineering applications. So how to fabricate or how to prepare these materials? So there are different kind of technologies available in current scientific field. Starting from we can develop the hydrogels, and we can develop electrospinning nanofiber materials, and then kind of gas forming method, and the salt leaching method using sodium chloride. We just place it into the material and this just leach it out. We can get the highly porous structures and the free form fabrication, and then topography library. And recently these are all the airbrush material. We can make the nanofibers, and of course the very recent technology is 3D bioprinting. In the previous presenter showed some kind of selling that is really useful to develop this kind of artificial tissue. Even you can make any kind of nose or ear, which not only used for, there are the 2 different function. One is we can make like we can replace the natural function of the tissue. That is usually we call it biomaterial. And sometimes we could our really we want to make our nose or ear so beautiful is comes from the cosmetics area. So our approach is more towards the implanted side. And what we have developed the scaffold material using the natural materials. So it has been believed that the natural biomaterial do not have any problematic or side effects. So what we have done it, we have taken the tuna bone. The tuna bones are really very big, is equal to the shark, and we have utilized 2 different kind of methodology. And there is nothing but we are just trying to use the tuna bone for our replacement of bones. So we have used two different kind of technology. One is thermal calcination method, and another one is alkaline hydrolysis method. And both method produced two different kind of material. One is starting from the micro hydroxyapatite, and another one is another one is a nano hydroxyapatite. And just mixing with chitosans, which is derived from crab shells, then we can make the kind of scaffolds which is more porous, as well as this porous can be utilized for nutrient supplement and also in blood flow. And what we have done it, and we have done with the cytotoxicity of mesenchymal stem cell, and found that the developed materials are non-toxic in nature. And we implanted this material in rabbit tibia, and rabbit tibia, just we cut and implanted this material, and we put some kind of wire, and we waited for different days like 8 weeks whether the bones are forming or not. And we found very interesting result in terms of this is the image we have inserted this scaffold in the rabbit. And then the histology stainings and microcd analysis suggested that the scaffold having the nanocytes giving better results than compared to the microcytes. So we have developed series of scaffolds starting from carbon nanotubes. Why we have used carbon nanotube in these structures? This is the one of the very strongest material known to the man compared to the any other materials. So we want to mimic, or we want to taking that advantage of mechanical strength of carbon nanotubes, which can be used for our bone tissue engineering mechanical strength. So we have developed different kind of scaffolds like using 25 milligram, 50 milligram, and 100 milligram, using lower weight molecular weight and higher weight molecular weight. And we check the porosity. The porosity is the only chitosan scaffold is improper pore structures. By addition of carbon nanotubes and hydroxyapatite, you can see that the hydroxyapatite is spreading on the polymeric matrix. And we check the viability because people are saying the carbon nanotube is toxic. But once it's functionalized with any other polymer, is toxicity is drastically decreasing, and which is compatible, and also it's giving good mechanical strength. As you can see that here the cells are growing on the scaffolds and in between the scaffolds. And we found that the scaffolds are biocompatible. And the another question is why we want to make the minimal invasive. For example, sometimes people may get very small fractures. That time what we thought that we want to make some kind of injectable form of this injectable forms. And we have developed with the single wall carbon nanotubes and the chitosans. And then we have characterized with the different kind of techniques, and you can see the TEM image clearly shows that single wall carbon nanotubes is mixed with chitosans. And we have developed some other scaffolds to chitosan allogeneic and figured on, and we have characterized it. And I want to say here, materials and the cells and growth factor, this is the best combination to develop any tissues, starting from the skin or bone or any liver, or in higher end even heart or brain too. So here chitosan allogeneic with the stem cell with the growth factor people have we have developed, and interaction with the mesenchymal stem cells. As we can see that the growth factor and the chitosan allogeneic is giving the better yielding ability than compared to the control and only chitosan and allogeneic. And come to clinical application, we are working on one dental project. And this dental project, the sinus slip is one of the very serious issue. And because of the sinus, we cannot able to implant the tooth. So for that, first of all, we have to develop some kind of bone graft, and then just it has to yield for some 3 to 6 months. And then once we get the some basement, then we can implant it. So this is in the form of solution. The advantage of this kind of material is minimum invasive and very easy to prepare, and highly bioactive and inexpensive, and also no need to for secondary surgery. And this is the preliminary data I have got it. And then it's not showing any toxicity. And come to the another portion, the cuttlefish bone. The cuttlefish bone you could have seen in the sea area, in the beaches. We can find a lot of cuttlefish bone. The cuttlefish bone is something different from our human bone composition, because the cuttlefish bone is having calcium phosphate rather than hydroxyapatite, but it has a very beautiful structures. It is the dorsal area and it's the laminae, and we can cut it with the pieces of material which we can implant it. But before that implanting, we need to convert it, this calcium carbonate, into hydroxyapatite. For that we have followed some different kind of method, like a diammonium hydrogen phosphate. We dipped into the overnight and the calcium carbonate and reacted with the diammonium hydrogen phosphate, then it forms uh, hydroxyapatite, and then we can implanted it, we can see that the hydroxyapatite peaks around 31 to 32, and this is confirming that uh, the developed hydroxyapatite is very pure in nature, and we can develop in any size we can develop it, like we can make a rectangle or square or even double shape or even spherical shapes. So any shapes we can develop based on the person requirement. And after that we implant it into the person and we see that whether it's regenerating or not. So this is exactly mimicking the natural natural bones of the person. And then we have developed some cuttlefish bone hydroxyapatite with the collagen mixture, and then it's showing very good biocompatibility. So now I'm taking into, these are all laboratory studies. Laboratory we can do all other research, but taking into this material into the commercialization, what is that big gap is there. That's why I think the last presenter presented so many options. They can definitely help you to take you, if you have some really very good knowledge or ideas, they will definitely help you and take it to the commercial levels. So but before going to, I would like to give some brief information about what are the taste or procedure we need to follow, just for understanding who really interested on this. One is, we need to definitely do toxicology perspective and biocompatibility and performance traits, and what are the requirement, and what are the regulation we need to follow, and what are the biomaterial associated infection. These are all the laboratory is available in which is approved by our government of India. So we have to get the certification whether this material is really biocompatible, we can go it into further level. And also we need to do several clinical trial, like clinical trial 1 and 2 and 3, to check whether our material is really working fine or not. And coming into the metal implant, so these are all the ISO 10993. So in biocompatibility there are uh, different tests we need to perform, starting from cytotoxicity, sensitization and irritation test, and acute systemic toxicity, and genotoxicity and implantation test, and also compatibility, and the carcinogenesis bioassay and pharmacokinetics. And this all 13 tests is not applicable for all the materials. It can be vary from one product to the another products. For example, if you are developing any kind of implanting systems, we really no need to go some pharmacokinetics study, because it's not going to go anywhere in our body. But still we need to find it out what's happening if you are implanting any. For example, in recently one case happened in Johnson and Johnson's, they are in really problematic because the magnesium ion is leaching from the implanted sites, is giving some miscarriage to one pregnant lady, and also some people have died. So you have to be very careful when you are taking in this material into the commercial perspective. So we have to study this all the tests before taking into commercializations. So I would like to give some biocompatibilities, how we are checking. This may be very simple for only the undergraduate students. So just I want to give some brief information. For example, scaffolds. Once we grow the cells, we just place the scaffolds on the top of the cells, and we incubate for sometimes. And then whether usually we used for 24 hours to until 96 hours until 5 days, and whether the cells are growing on the scaffolds or not. So based on that, we can say that the developed materials are biocompatible or not. For in this case, actually, we can show the scaffold is killing the cells. So in that case, the developed materials are toxic in nature. And one more thing, actually, if you have any questions, you just write to me and I will answer in the final stage. So the next step is, so developing this kind of implant system or bone graft system is not a very short period of time. We really need very long way. At least for research and development itself takes around 5 years to develop even 3D printing materials or scaffolding system using freeze dry technology or particle etching. It usually takes time like 1 to 5 years, and then the development is like a clinical trial. It takes another 2 years, and we need to get some regulatory approval. uh, yes, regulatory approval from the government of India. Once you get, if you see that is really need to around 10 to 12 years to develop one product, then only we can go for commercial. So but this kind of commercialization nowadays is becoming very easy using the new technology, especially for electrospinning or 3D bioprinting and some other technology. So we are from Elopoya Research Center. Just I would like to give what we have it with us. Uh, like, just I want to show what are the facility we have it, and then this is our campus is located in Karnataka, and then we have accredited with several certification. Of course, we are top 100 in NIR, and some of the certification we got it. We have an ABL laboratory and some collaborative works, and we are very specialized in dental college. We are developing, of course, all the bone grafts in house, and these are all the digital lab which we have it, and several clinical trials is going on with us, and then these are the imprinting materials implantation, and these are all the base which are used for the old people, and this is also like a crown, and this is our area. It's like a research center, and we have one biotechnology and nanotechnology. This is we are belongs to, and we have more than 24 faculty in different disciplinary and microbiology and molecular biology, and also we have it. Uh, we we have it like omics lab, one lab, and we have mass spectra, and then one bioinformatic group. Some of the faculties is working on more towards to population genetics, and they are more interested to why the COVID is not affecting in India. And we have one stimulation center which is available in the medical college. So they usually do some artificial pregnancy surgery, and one more thing, we have some robotic surgery, laparoscopy surgery, and then simulation center accent, and some pediatrics. These are all just them making like artificial one, and yeah, and these are all burn one. We can just yeah, this is called exactly cardiac arrest, and we have some robotic and automation labs, and we have the NFI Institute of Technology. They are very closely related to this, and then yeah, that's it. And then we have around 24 faculties in different disciplines. As I said, this is our ORC team, and we have more than 100 PhD scholar who is supported by CSIR and DBT or UGC or something. And then these are the funding agency which is help me to conduct some kind of research. And thank you so much. And if you have any questions. I don't know. Do you hear me? Hello? Anyone have any questions? So I will try to answer you. Okay, so you got. Okay, so I will answer you. The first question is, will this technique of tissue changing helpful for the person suffering from arthritis? If yes, what are the challenges of recovery? Yeah, this is one of the very tough questions. The arthritis, it's not exactly like yeah, bungle is. Can you hear me? Right. So I will try to. Okay. Yeah, arthritis, it's very difficult disease. It's more or like uh, heredity, and but still we are not going to use any tissue engineering technology until now, but we are using some kind of drugs, so which we are taking, but still the recovery rate is not up to our mark. So it takes some time to find it out this kind of arthritis or knee related some damages. Yeah, one more person is very interesting question. She has asked Crunchy and how is called, I think, fullerene materials can be used as a biomaterial. I think fullerene, right? Yes, we can use it. Uh, yeah, we can use it, but the problem based the carbon based material, there are several controversies is going on, whether it's giving toxicity, and we really do not know about the long term toxicity of carbon based materials, especially even fluorine or even graphene oxide, even transition metal ions, or any other materials. We don't know long term effect, so that one we need to consider before using any carbon-based material for tissue engineering applications. So, so right now is that's why I more focusing on a natural-based material. Whatever I proposed in carbon-based material, I've used like 10 years ago. Using natural material which can drastically decrease its toxicity. So, yeah, that is my answer for you. Uh,
हल्का लिखा था तुमने, वही लिख दो। कर दो यस।
yes, another question. Hello. If you have anyone have question, you just need to message. Otherwise, you can ask me to.
all these things are going to create a hell of a problem. So industry association and individuals please kindly note, and you are expected to receive occasional reasons unnecessarily from the department also. Please be prepared. So here we have to seek more clarification on account of the undefined terms like goods and service based supply. The another major issue is how to deal with situation where there is a no comparable goods at all. So absolutely there was a no information is available, no clarification is available, 100% UEO units for. And there are some domestic suppliers they can exclusively manufacture for the export purpose. We don't know how to handle that. So here there is a major.
Super. Uh, thank you, Venkatesh sir, for your presentation. I have muted everyone, and if any queries are there, please post it onto the chat. Or if you wanted to tell it, please raise hands. Your mic will be switched on. Venkatesh sir, there is a question from Dr. Wong on how
Yeah.
to address on CNT safety.
Yes, actually, that is one important concern about who is working on a carbon-based material for biomedical application, especially for tissue engineering or drug delivery. Even though it's giving very promising result in terms of all the perspective or aspective, and but the toxicity issue it's still problematic because really do not know what will happen for longer run. For example, if you are implanting CN based material into our body, it may leaching out and it may give some kind of cancer or some other diseases. So that's why we need to functionalize with some kind of polymeric material to reduce its toxicity or drastically decrease its toxicity and also increases its biosafety. So we need to make some kind of composite material, or otherwise we need to make some chemical functionalization to improve its bioactivity for biomedical application, especially for tissue engineering or drug delivery.
Um,
Yeah, one
Venkatesh sir,
person
we
is
are
asked.
yes, sir, on the
Yeah,
elements.
from Anil. Yes. So it depends on the tissue what you want it exactly. So for example, if you want to develop any kind of, we can separate like a three different tissues. One is like a first level of tissue is our skin. The second, because the skin do not have any function, but if you go like the secondary tissue is kind of bone, and the tertiary tissues are really functional organs like heart, kidney, liver, or brain. So what we are working on biomaterial right now, this first level only skin. So we are developing the skin. So in that case, what we have to do it, we have to really consider the porosity. For example, in the strength and compressive strength, or fractional strength, or tensile strength, and mechanical strength and porosity and water uptake and retention ability, And apart from that, it has to induce some kind of genes like collagen 1 and some kind of TGF beta or some kind of gene it need to interact. So these are the parameter we need to consider. Okay. Uh, yes. So the second question is how to fix the bone. How to fix the bone? Right now we do have like a bone graft using hydroxyapatite. We can use it, and using that hydroxy is a well-known material, but still we need to make some kind of 3D printing hydroxyapatite having the advantages in terms of porosity as well as the mechanical strength. What kind of measure used in biomaterial in medical? Yes. Actually, biomaterial is a wide topic. Wide topic, especially what I know it like majorly one is biosensor, and another one is drug delivery, and another one is tissue engineering. These three major field is comes under biomaterial only. Of course, a lot of this diagnostic kit which is based on biosensor, and but we are not but those are not implanted in our body until now, but it's going to happen soon. And another one is biomaterials in tissue engineering. Hydroxyapatite is a well-known one, and there are some synthetic polymer like polycaprolactone or polylactic acid, polyglycolic acid, and the combination of different biosilica materials, or in the use of bone graft implant or bone graft. And in drug delivery is all the material, of course, it comes under liposomes, also comes under the biomaterial only because it's going into the body and delivering the drugs. What about using artificial bone for drug delivery? Yes, there are some options, particularly the person having the bone tumor. So he really needs some kind of drug. So we can add some kind of anti-tumor drugs into the graft itself. So the drug will release from the graft, and it will kill the tumor cells. And once it kills the tumor cells, the bone regeneration can happen. Under study in the institute. Yeah, one more question is Anil. Yes, we are allowing the internship, but sometimes what happened, we are overwhelming with many students. So that's why they are charging some money around 3 months, like 10,000 rupees. And but we are allowed to use any chemicals and the instrument in our university. The eligibility criteria, we need to have one master degree. The master degree student can do internship in our university, and well, we are allowing the PhD candidate also. So we just go through our NPI Research Center websites. You can find out a lot of people's having a wide range of expertise in throughout the world, mostly from US and Europe countries. So you can select it if you really want to work on the particular field. You can directly contact them. They will guide you. They will discuss with the deputy director and VC, and then they will take the decision on regarding any internship or PhD guide. And one more thing I want to tell you about this tissue engineering is started around 20 years ago, but still we are in very early stage because it's not so easy to mimic the natural function of uh, our any tissue. So, but one day it's not very far. Maybe in this generation, because of the technology development, we are very close to develop any full functional tissue. People have developed already mini brains and then beating art. Even we could have seen some of the YouTube videos. People have developed in Weizmann Institute and then Israel. It's a beating art. It's really beat. Even in our stem cell, we have one stem cell groups. So they are working on cardiac tissue engineering. So that stem cells really beats like our human tissue. So, but we need to find it out. Uh, Yes, so what is the status of research in India? Very top institute they are working on from IIS Indian Institute of Science, the Material Engineering Department, I think Professor Kaushik is working on this one, and IIT Kharagpur, Biman Mandal, and person from IIT Delhi, and even IIT Mumbai. So all the top institute, they are working on this tissue engineering using different kind of technology, especially 3D bioprinting is one of the emerging area of research, the combination of cells and materials. And but still we are working on a second, as I said, in second level of tissue like bone. People are developing in third level, but it's still we have to go little far. Any product commercialized? Yeah, it's a very interesting question until now. 3D printed, it's not yet commercialized for biomedical application until now, but we can see that Chichitra walls is commercialized very long before. So that is a one Chichitra Trinal coaching. This is one of the pioneer of biomaterial research. So they have commercialized already. Chichitra wall is very famous. Chichitra bone graft also is very famous. And some products, especially Biman Mandal, they have commercialized some product. Yes. And so, and you can write me if you have any questions. Maybe you can find it out my email. Muscular dystrophy. Yes, exactly. It will work. Yes, because even we can go in our research center. We can find it out. One person, Sudhir Sinha. So he's expert in that area. He's working on muscle regeneration. Sudhir Sinha is a doctor one. He has great expertise in muscle stem cells. So it will definitely helpful. Definitely it will work also. So yeah, that is it's based on the management will decide whether they want to take us. It depends on, I cannot register something. This depends on the management availability. Yes, neurons, of course, any tissue we can make it out. Any tissue we can make it out. It depends on the cell types because our body is made up of fully cells. So we can make neurons, but it's really very far because we are very far from the brain. My bad. What is this? Kindly need my pot. Pot. What is pot? So maybe what is pot? Partner, maybe. So one more thing, we also having Anapoya research, Anapoya incubators, Anapoya technology incubator, and we are just establishing with the 3D bioprinting, but our focus is mostly towards only medical side. So we do have bioprinter, and then and our expertise is more towards the medical sides. So but it's a very interesting topics, and people they want to do continue their they want to continue their career in this area. It's really good. It's little bit. Yes, the fluorine can be used as a biomaterials, but it's very difficult to commercialize it because we really do not know the toxicity of fluorine. So we can work. Of course, we can get the grant, we can write the papers. And as per my perspective and knowledge, it's very difficult to commercialize that kind of product in the market because we have to follow many regulatory affairs. So it will take time. Yes. So maybe we can close it, or if you have any questions, and feel free to write me to my email. And
Okay,
then,
Venkateshan sir. Okay, Venkateshan sir. Thank you for the presentation. I hope any further questions can be posted to his mail personally or to the SASB mail so that we can forward the same and get back with your answers. And let me close the session by thanking all the three speakers who had given their valuable time. Let me thank Dr. Wong from Malaysia because he was there throughout the presentation and his presence was really, really helpful for many of the nurturing students, and also many scientists and researchers who are there listening the entire session and his session as well. And I also thank Venkateshan and Dr. Surya Raj for their valuable presentation. And I would also bring to your kind notice that SESB has certain online courses which will help the students community to learn better, because CRISPR is a new technology that has been growing in India. So for all these things, you can visit our website and mail us personally so that you get the details on it. Thank you all. Thank you for be here for the presentation. Thank you. Thank you, sir. Participant, please give your feedback. Feedback link was already been shared to you. If you have missed the link, I'm reposting it now. Kindly fill the feedback and see to that your name is typed properly, so that the same would be printed onto the certificate. Thank you once again. Thank you for the participation.